Welcome back to the Boomerang e-learning portal and the Academy. The Academy is where you get to ask questions of the experts. Dr. Bluskowitz on obstetrics, gynecology, and the Empower and Pelvic Female Wellness, and all other services. Dr. Dorn on dry eye syndrome and the Envision. Dr. Bluskowitz is the Empower. Dr. Meningus on any topic whatsoever, including his Exodus book. And me, any topic you want. We get a lot of questions on the Morpheus and some early post-in-mode training get a bit confused of when they should use cycle versus fixed and what's the difference, and when to use stacked versus multiple passes. And so first of all, cycle versus fixed. Cycle is the default setting. In cycle, you get protrusion and retraction in 1 second. In, out, out. And as it protrudes and gets to the endpoint of the depth you set 4 millimeters, 3, 2, 1, or at the M40 body, 7, 6, 5, 4, 3, 2, 1, or burst. At the end of the protrusion, you get release of the energy, whatever energy you set, the coagulation and the ablation. So it's important that when you have cycle and you have 1 pulse or 2 pulses per second, you have the right cadence. So you're always on the skin when there's protrusion and then retraction. That's cycle. Automatic protrusion, retraction in 1 second, either with burst, with the M body, 7, 5, 3, 6, 4, 2, or unburst, which is 1 depth and then retract. That's opposed to fixed. When fixed, there's a protrusion, but you keep your foot on the pedal and RF keeps getting emitted. 1, 2, 3, 4 seconds. And then when you take your foot off the pedal, it retracts. That is fixed. What does that allow you? Long pulse duration contouring and custom contouring. So I use fixed mode when I want more fat destruction or FSN tightening. And I use cycle mode when I need less fat destruction and faster treatments for FSN and subdermal remodeling. Now this was kind of a hybrid question because the second question in the first question was the difference between stacking and fixed. And well, stacking is when you use a reciprocating pulse typically and you go once, twice, 3, maybe even 4 times down the same coagulation zone hole. The problem with that is that RF travels poorly through ablated tissue. So the first penetration, ablation, coagulation, and retraction is the most optimal. Every single stacked pulse after that, you get 25% of the original ablation coagulation each time. So it's the law of diminishing returns because RF does not travel well through ablated tissue. So my recommendation is never stack. Rather do 3 or 4 passes in new penetration zones and new virginal fat so RF travels up to the navel. It does more optimally than stacking. And you can then do fixed pulses and multiple passes, but don't do fixed stacking. So stacking, no in my opinion. You have the law of diminishing returns for the 2nd, 3rd, and 4th stacked pulse. Do 4 passes, takes the same time, but you'll never be down the same hole twice and you get virginal fat. The disadvantage is you get more puncture points in the area, so make sure they're not prone to post-inflammatory hyperpigmentation. So I hope that helps. That was an excellent question.